Chapter 5, Role of the Government in Health. Terms to learn. Communicable diseases. The diseases that are spread from one person to another in many ways, such as through water, food, air, etc. Public. An activity or service that is meant for all people in the country and is mainly organized by the government. Primary Health Center (PHC), a health center which covers many villages in rural areas. OPD. This is the short form of outpatient department. This is where people are first brought in and treated in a hospital without being admitted to any special ward. Anganbadi, a place where the mothers and their children's health is taken care of. You have read in the previous lesson that the health facilities provided by the government hospitals are not easily available for all. Rich people, however, can go to private doctors or private hospitals and nursing homes to get proper treatment, but poor people have to stand in a big line in the government hospitals. In a democracy, people expect the government to work for their welfare. This could be through the provision of education, health, employment, housing, roads, electricity, and water, etc. Health is the most important issue because if a person is not healthy, he or she can't concentrate on studies and do physical work. If health facilities are not provided to all, the concept of equality loses its ground. What is health? Usually, health refers to remain free from diseases and injuries. But health is not only about diseases. Apart from diseases, we need to think of other factors that affect our health. For example, if people get clean drinking water, balanced diet, pollution free environment, they are likely to be healthy. On the other hand, if they live in unhygienic conditions where there is no proper drainage system and proper arrangements to dispose of the urban waste, they will be prone to diseases. For example, people living in slums in big cities are more prone to diseases as compared to people who live in well planned colonies. It isn't healthy to be dull, inactive, anxious, or scared for long stretches of time. We all need to be free from mental strain. All of these various aspects of our life are a part of health. Healthcare in India. Health facilities have grown substantially over the year. In 1950, there were only 2,717 hospitals in India. In 1991, there were 11,174 hospitals. In 2000, the number grew to 18,218 in 2011. India has the largest number of medical colleges in the world and is among the largest producers of doctors. Approximately 15,000 new doctors qualify every year. A number of foreigners came to India for treatment. Some of our hospitals compare with the best in the world. India is the fourth largest producer of medicine in the world and is also a large exporter of medicine. All the above facts reveal the positive aspects of healthcare facilities in India, but there are various negative aspects also. Some of the negative aspects are: most doctors settle in urban areas. People in rural areas have to travel long distances to reach a doctor. The number of doctors with respect to the population is much less in rural areas. We should keep in mind that India is the second most populous country in the world, having a population of more than 1 billion, and about three-fourths of the population of India lives in villages. About 5 lakh people die due to tuberculosis every year. This number is almost unchanged since independence. Almost 2 million cases of malaria are reported every year, and this number isn't decreasing. We are not able to provide clean drinking water to all. 21% of communicable diseases are waterborne. For example, diarrhea, worms, hepatitis, etc. Half of children in India do not get adequate food to eat and are undernourished. Looking at the above situations, we can draw a conclusion that the health of an average Indian is not good. The number of sick persons is more compared to the medical facilities available in the country. With all the positive developments in the healthcare facilities, we are not able to provide proper healthcare facilities to all people. Our country has the money, knowledge, and people with experience but cannot make the necessary healthcare available to all. In this lesson, we will look at some of the reasons for this. Healthcare services. There are two types of healthcare services in India. A. Public health services. B. Private health services. A. Public health services. The public health service is a chain of health centers and hospitals run by the government. They cover both rural and urban areas. They can provide treatment to all kinds of problems from common diseases to special diseases. At the village level, there are health centers where there is usually a nurse and a village health worker. They are trained in dealing with common diseases and work under the supervision of doctor at the primary health center. Such a center covers many villages in rural areas. At the district level, there is the district hospital that also supervises all the health centers. Large cities have many government hospitals. Some are specialized government hospitals. The health service is called public because the government has established these hospitals and health centers. Also, the resources needed to run these services are obtained from the money that we, the public, pay to the government as taxes. Hence, such facilities are meant for everyone. One of the most important aspects of public health system is that it is meant to provide quality healthcare services either free or at a low cost so that even the poor can secure treatment. Another important function of public health is to take action to prevent the spread of diseases such as TB, malaria, jaundice, cholera, diarrhea, chikungunya, etc. This has to be organized by the government with the participation of people, otherwise it is not effective. For example, when taking up a campaign to see the mosquitoes do not breed in water coolers, rooftops, etc., this has to be done for all houses in the area. According to our constitution, it is the primary duty of the government to ensure the welfare of the people and provide healthcare facilities to all. The government must safeguard the right of life of everyone. Here is the story of Hakim Sheikh. Hakim Sheikh was a member of Paschim Banga Khet Majdoor Samiti, PBKMS, an organization of agricultural laborers in West Bengal. One evening in 1992, he accidentally fell off a running train and suffered head injuries. He was in a very serious condition and needed immediate treatment. He was taken to government hospital in Kolkata, but they refused to admit him because they did not have a spare bed. Another hospital did not have the facilities or the specialized doctors necessary for his treatment. In this way, he spent 14 hours in a critical state and was taken to 8 different government hospitals, but none of them admitted him. Finally, he was admitted to a private hospital where he received treatment. He spent a lot of money on his treatment, angry and upset over the indifferent attitude of all the hospitals that refused to admit him. Hakim Sheikh and PBKMS filed a case in the court. The court also said that it was the duty of the government to provide the necessary health services, including treatment in emergency situations. Since Hakim Sheikh was denied treatment at various government hospitals, therefore the court asked the state government to give him the money that he had spent on his. B. Private health facilities. This is a wide range of private health facilities that exist in our country. A large number of doctors run their own private clinics. In the rural areas, one finds registered medical practitioners, RMPs. Urban areas have large number of doctors, many of them providing specialized service. There are hospitals and nursing homes that are privately owned. There are many laboratories that do tests and offer special services such as X-rays, ultrasound, etc. There are also shops from where we buy medicines. In private facilities, patients have to pay a lot of money for every service they use. Poor people can't afford to avail the private health facilities, so they have to go to government health centers or hospitals where they have to stand in big queues to avail the various services. The cost of cure in the private and public health service. The following illustration throws some light at the cost of cure in the private and public health service, as well as the problems faced in the public health service. Ajit and Vijay were good friends. While Ajit belonged to a well-to family, Vijay belonged to a very poor family where parents had to struggle to make ends meet. Both were suffering from viral fever. Ajit's father took him to a private hospital with the best of facilities. It looked like a five-star hotel. Ajit's father had to pay rupees 500 at the reception counter itself. The doctor asked for many tests, but everyone was so friendly that Ajit forgot his pain. After the test results came, they went back to the doctor. The doctor looked through them and said that everything was fine and Rahul only had viral fever. He prescribed lots of medicines and rest. The total treatment costed more than 3500. Vijay's father took him to government hospital. They had to wait in a long queue at the OPD counter. Vijay was feeling so sick that he had to lean on his father's shoulder while standing in the queue. When his turn came, the doctor examined him and asked for a blood test. Then they had to go and stand in another long queue. People were crowding around in the testing room too. They got the test results after 3 days and went back to the hospital. There was a different doctor that day. The doctor said, "Show me the OPD card and the results quickly, please." After looking at the result, the doctor said, "He seems to be suffering from about a viral fever. Nothing to worry about. All he needs in this one fever reducing medicine." Vijay's treatment costed only rupees 150. Healthcare and equality. In India, we face a situation where private services are increasing but public services are not. What is then available to people are mainly private services. These are concentrated in urban areas. As these services are run for profit, the cost of these services are rather high. The doctors sometimes prescribe unnecessary medicines and tests are expensive. Many people cannot afford them. Hence, even for those who might not think as being poor, medical expenses cause hardship. It was reported in a study that 40% people who are admitted to a hospital for some illness or injury have to borrow money or sell some of their possessions to pay for the expenses. For those who are poor, every illness in the family is a cause of great anxiety and distress. Those who are poor are in the first place undernourished. They are not provided basic necessities like clean drinking water, adequate housing, clean surroundings, etc., and therefore are more likely to fall ill. The expenses on illness make their situation even worse. Even in the government hospitals, everything is not free. You have to pay for tests, though of course much less than the private hospital, and have to buy medicines. Sometimes it is not only the lack of money that prevents people from getting proper medical treatment. Women, for example, are not taken to a doctor in a prompt manner. Women's health concerns are considered to be less important than the health of men in the family. Many tribal areas have few health centers and do not run properly. Even private health services are not available. The rural people, in case of emergencies, are unable to get prompt treatment. They have to travel long distances or to the nearby towns to see a qualified doctor. What can be done? It is true that the health situation of most people in our country is not good. It is the responsibility of the government to provide quality healthcare services to all its citizens, especially the poor and the disadvantaged. However, health is as much dependent on basic amenities and social conditions of the people as it is on healthcare services. Hence, it is important to work on both in order to improve the health situation of our people. The Kerala experience. Kerala is a small state in the southern part of our country. It has the highest literacy rate in India. In 1996, the Kerala government made some changes in the state. 40% of the entire budget was given to panchayats. This made possible for a village to make sure that the proper planning was done for water, food, women's development, and education. This meant that water supply schemes were checked, the working of schools and angarwadis were ensured, and specific problems of the village were taken up. Health centers were also improved. All of this helped to improve the situation. Despite these efforts, however, some problems such as shortage of medicines, insufficient hospital beds, not enough doctors remained, and these needed to be addressed. The Costa Rican approach. Costa Rica is considered to be one of the healthiest countries in South America. Several years ago, Costa Rica took a very important decision and decided not to have any army. This helped the Costa Rica government to spend money that the army could have used on health, education, and other basic needs of people. The Costa Rica government believes that a country has to be healthy for its development and pays a lot of attention to the health of people. The Costa Rica government provides basic amenities to all its citizens such as drinking water, sanitation, nutrition and housing. Health education is an essential part of education at all levels. Since health is primarily a state subject, it is essential that every state provides more funds to health services and basic amenities such as clean drinking water, nutritious food, and proper housing facilities to all people. Lesson at a glance. Health is the most important issue because if a person is not healthy, he or she can't concentrate on studies and do physical work. Usually health refers to remain free from diseases and injuries, but many other factors affect our health such as availability of clean drinking water, balanced diet, and pollution-free environment as well as to be free from mental strain. The public health services is a chain of health centers and hospitals run by the government. There are a wide range of private health facilities that exist in our country. A large number of doctors run their own clinics. They are private hospitals and nursing homes. In Costa Rica, a country in South America, a decision was taken not to have any army and the money that the army would have used was spent on education and other basic needs of the people such as drinking water, sanitation, nutrition and